Hi, this is Supriya Shetty. I am the dentist in Integrative Dental Solutions. Here is Shirley. Shirley and me work together with our tongue tie release. So Shirley, can you give us a little gist of how we work together?
Yeah, it's been really fun and really entertaining, not entertaining, but educational.
Some days it's entertaining.
Some days you just can't help but laugh, but it's been really educational. I started as a myofunctional therapist in 2016 when my son and I opened Primal Air, and I had no idea how many patients had tongue ties. I was shocked. I thought, oh my gosh, did I turn into a tongue tie broker? And but it's that's who's coming to us, because there's the tongue tie can impact so many different parts of your whole system and how your muscles work and everything. And working with you has really helped develop that understanding. And so when you send patients to us, you're like, oh yeah, she's a tongue tie specialist. We'll let her decide, and so it's a really nice collaboration, because then I can refer back to you and say, well, let's see what Dr. Shetty has to say about it.
Yeah, that's right. I really love working with you and the connection we have together as a team. I personally believe tongue tie releases are not just an individual, it's a team effort. It is a myofunctional therapist, as you can have a chiropractor involved in it, we have a craniosacral therapist involved, and an ENT specialist. So it's a team effort, and I really like working with you together. And I love that you can be in the office when I do the release, because it helps me to have that second eye to release it. And when it's like I can see it from my angle, it looks good, and you're like, no, we need this more release. I really like that. Shirley, can you help the patients or the people seeing this video is like, why would somebody release a tongue tie?
Yeah, that's a really important question, because we've had patients that were in their 60s and they're like, why didn't anybody notice this before? Or, what took so long? Or I'm so old, why should I do it now? The interaction between the tongue tie and the muscle tension in the neck alone, I think, is what most people appreciate the most. That once their tongue is no longer glued to the floor of their mouth or not mobile enough, they have a lot of tension in their neck and even breathing. We hear that a lot when you release the tongue. It's like, oh, I can breathe so much better. And both of us are like, oh, great, because we weren't planning on that, right? So, and our other older patients have other symptoms relief that we never dreamed of. We've had one person burst into tears just out of
Just crying.
Yes, right. And she eventually called and said, I used to have pelvic floor issues. I've been working on it for a year, and they're gone. We have another patient, 60 years old, 62, and she's like, I've not been constipated since my tongue tie release. And I'm like, that sounds fabulous. I wouldn't put that on the list of things to look for, but we just don't know, because it's so interconnected.
I agree. So and as a dentist, that's my place of what I focus on. And so evaluation on a new patient or on patients that are coming into, because when I started doing tongue tie, I was doing more of anterior tongue tie evaluation. And now in the past 4 years, I'm looking into the posterior tongue tie release.
Right.
And the posterior tongue tie was something like, people thought the posterior tongue tie was something was attached in the back. No, it's an extension of your anterior tongue tie, which most of the dentists, we fail to recognize. And now more and more people are becoming aware of it. Now, also with tongue tie, that when we refer patients out to you, like we also tell our patients, like, not every tongue tie has to be released. I want you to be the person who makes that evaluation, where you do the training. Sometimes a person just doing a myofunctional therapist could get a big benefit, and then when they're ready to release a tongue, they can release it. It'll make an additional benefit. But definitely seeing a myofunctional therapist before the release is very important to me, and I think you agree with it too, right?
Yeah, because they're not ready. The tongue is just a blob of tissue, And when we're finished with the prehabilitation phase, you can even see
Yes.
the frenum where you may not have been able to see it before.
And the advantage I think with working with you is I have done tongue tie releases in the past where long time ago, like we've not had a myofunction therapist, but now when I've started using for the past three years we've been working together, I see better healing, less bleeding during his release, and I think that makes a big difference working with the myofunction therapist too. I always, when I refer patients to myofunction therapists, they cannot understand what it is, and I will tell them, it's like a wild horse, your tongue is. It's been held in this position for a long time. Once it's released, it doesn't know where to go. So you are the trainer of the wild horse who tells exactly how tames it up, tames a wild horse, and sends it back to me to release. And once it's released, you train it again to behave well.
Yeah, I use the same word, behave. Like, your tongue needs to behave. So yeah, it's been great, and I'm looking forward to continuing on because this is a field that's like expanding.
I appreciate your time.
chrysanthemum.
Thank you for helping a lot of our patients.